Hi everyone, and welcome to the third in the series of the LSN's Ask the Expert videos. I'm Anita Wallace, Chair of the Lymphedema Support Network, and I'm delighted today to introduce you to the LSN's nurse advisor, Denise Hardy, who runs a very busy practice in Kendal, and she's very, very experienced. So I'm delighted that she's agreed to come on with us, and we'll get going on the questions. Sometimes lymphedema can feel very hard and solid. And what can be done to help that, Denise?
Yeah, you're right. It can feel hard and solid. And that's usually patients who we see for the first time who've perhaps not had treatment, and their lymphedema is quite severe in nature. So over time, the lymph becomes really firm, and we call it fibrotic. And the pitting, where you normally can leave a mark in the skin, it's not possible anymore. And so it becomes very tense and dense in nature. And patients feel that it's really heavy and uncomfortable. But equally, you can get that from time to time, perhaps if you've had an infection in the arm or the leg or the area of lymphedema, and that causes the area to become quite hard and firm. And so it's trying to break down that tissue in whichever way we can. Yeah. So the best thing to do, of course, is to stick with your usual self-management regimen. So exercising, your skincare, and wearing your compression garments, and making sure that those compression garments are the optimal fit. Sometimes the garments start to lose their strength, and therefore they don't work quite as well. So if your garments are more than 6 months old, for example, it might well be that because they're so old, the elasticity has gone and the swelling gets bigger as a result and becomes much firmer and tenser. So by getting the garment replaced, that will address the tissues, and that will then start to soften them again. But sometimes you need to do other things to soften it. And that can include massage techniques onto the limb, where we teach our patients to do maneuvers on the tissues to gently try and soften it. Again, we talked about the low-level laser earlier. That's another useful tool that we use in clinic. And it sometimes just takes a couple of visits just to apply it, and it softens up really nicely. The kinesiotaping is another way of doing just that. You might have at home a little roller that you might be using behind a radiator, for example. So something like this, for example. Oh, yeah. And they're really good for just, again, smoothing over the tissues, and that will help to soften them and make them softer and more supple again. You might be lucky enough to have a little massager at home. And again, this is a vibrating massager that, again, can really help to break down the fibrotic tissue in those particular areas. So those are the general things that I would be suggesting for people who've got firm fibrotic tissues. Majority of the time, it's using your hands to really try and break it down, and then putting the compression garment back on, an optimal compression garment, one that is not clapped out, not worn out, that's been replaced quite recently. Yes. So that would be my top tips, I think, in regard to managing that.
Lovely, thank you, thank you.